Figure out how to do this.
You're doing fine, Todd.
It's working.
That was so funny that day. That was so funny that day.
Lift your right arm and then get more C. I don't know why. Touch the button and hit your right arm and get more signal that way.
Two fingers.
We should just tell people that.
I'll go ahead and call the Health and Welfare Committee meeting to order. We can do voice roll call, please, Ms. Gwen.
Nick Holder,
Here.
Avery Wynn.
Here.
Angie Odom,
Here.
Gary Prophet, Lisa Childress,
Here.
Bob Smith.
Here.
Daniel McIntyre,
Here.
Thomas Prophet.
Here. Y'all take a minute. Look over the agenda. Need a motion to approve it, please. Make a motion to approve. Second.
Oh, you say.
Motion by Thomas Prophet, second by Avery Wynn. Yeah. Yeah.
Nick Holder,
Yes.
Avery Wynn,
Yes.
Angie Odom,
Yes.
Lisa Childress,
Yes.
Bob Smith,
Yes.
Daniel McIntyre,
Stein.
Thomas Prophet.
Yes. All right. Take a second, if you don't care, to look over the minutes for the May meeting.
Change it to the yes.
I wonder what he was abstaining for approving the agenda for.
I got ahead of myself. I was ready to move
You
on.
were thinking about the meeting.
I thought the sun might have got to him.
It's getting there.
Looks like he's been out in it a little bit.
I'll say.
Thank you all with me. What done?
I'll make a motion to approve the minutes.
Motion by Mr. Prophet, second by Mrs. Odom. Will you abstain on this if I say all in favor?
I'll have to on this one.
All in favor? You opposed? Public comments, none? Great. I don't have anything under old business, but as far as new business goes, I'd like to discuss the purchase of a new ambulance for EMS. As all of you know, Ballot is going to be purchasing one. However, the stipulation was if we purchase one, they'll purchase one. If we don't, they lose that one. So we're actually getting two for the price of one. And their lowest their ambulance with the lowest miles is right at 100,000 miles, just a little bit under. I think about 90, is that correct? 96,000 now. You got to keep in mind, these ambulances get put 40 to 50,000 on them a year. And I know I actually saw the agenda from June of 22, and it was second on the ARP funding, but it got removed somehow, some way, somewhere down the line.
If I'm not mistaken, this committee's the one that, is that correct? This committee's the one that created that list, and I know some of y'all wasn't part of that. But at the time, we had a list, golly, it took up almost 2 pages, and we went through and kind of leveled what we thought was most important at the time. But then I think it got sent to budget, and then budget kind of took the list and made a new list. No offense to anybody from budget if you were on it, but that's kind of a rundown of what happened with that list. And the ambulance was, I think, exactly number 2 on that list. So it was at the time a necessity. I think you'd come and presented about how it was a necessity at the time. We viewed it that way, and that's why we put it at 2. So just to give you all a heads up on where we were at that point in time. And I don't think anything's changed a whole lot from then till now.
Chair, is this the ambulance that's already ready?
It is.
And it's ready and it's lettered and everything?
Been sitting up there for, well, 30 days. Been sitting right at it. I can't remember the date that they said they would sell it. 12, something, but I did call and ask him, I said, we're still working. He told it, but he didn't get back with me.
And it's 221,000 some change. Is that right?
Yes.
Yeah.
It was initially 240 something, but the difference was they didn't include the cot in the quote, so
Right. And
we're ordering the cot ourselves.
the cot for that, for just an ambulance, is running about 25,000 for a cot. And if we don't grab this one, it's a domino effect that Valley will take it away. Plus, buying one that next year, because it's so far out to get an order through, it's a jeopardy of losing all 3 trucks. And if that's possible, but if they go and buy this truck, it'll get back up to where we can do all this. Now, I went and financed, and I haven't got anything back from the bank. And should know soon. I thought it'd be sooner than it is now, but I'm still willing to pay for that truck, hoping that they'll pass it through through the committee or whatever, and pay for this truck. And we'll back out. And their ambulance is right at 310,000.
How much is a cardiac monitor now?
42,000.
That sounds right. I'm
About
not sure.
42,000.
That sounds right.
Two pieces of equipment's almost $70,000. I remember when cardiac monitors were 15,000, and that was a lot of money. That's just, and you've got drugs that are thousands of dollars.
In this line of work, everything that attaches to medical goes up all the time. There's like no stopping. It's just every time we turn around, something's gone up. And the way the industry was with these ambulances, we was looking at 2 years better to get a truck. I sure can't wait till 2 years, and then it goes by and gets approved it, and then have another 2 years out. Union County had the same problem that I'm doing right now. Is because during that process, it took 2 years for it to get the truck ordered, get it in line. They done away with this truck. Now they're back, they've already passed it and got the truck, but he was fighting the same thing over again because somebody took it out of the lineup. Somewhere it got took out here, and there's no records of it. There's no records of nothing, of August meetings or nothing. I've been told that by fellow commissioners that they had a copy. They won't prove it to me. But guys, I'm telling you, it can make and break us to a point. If the ambulance stuff don't go through, and I have to buy them, somebody's going to be laid off. And there goes your times and our bill every time we start trying to build. So I'm not threatening nothing. Don't get me wrong. I'm just telling you the facts. It's got a little bit better. They're down to about a year and a half, year and 12 months of getting trucks in. This process has been going over 2 years now. And the truck's done and sitting there.
Use this softer springs on them. As someone who has recently used it.
Terry, can I ask a question?
Absolutely.
A clarifying question to Terry, please. I just want to make sure that I've got this straight. You're purchasing an ambulance, and then is the county looking at getting an ambulance? And
Now, in this budget, last year's budget, we had in there for that ambulance, to purchase. After that, when I found out about the ARP money, I came to the full commission and told them to take it off. If you'll buy an ARP, it'll save you all money. You ain't coming local, it's coming from the federal government. That's what ARP money is there for. And they agreed. And everything went all to pieces as far as trying to understand it, who ordered it. You didn't have a bill. I ain't had a bill in 30 years I've been here. I brought it down, the invoice, give it to them, and they said they'd purchase it, and there you go. Maybe it's my mistake that I didn't have an invoice from the county. I don't know.
So we're actually only looking at
One truck.
one truck?
One truck.
One truck, and then what is Ballot? I heard you say something about Ballot Health. What is it that they're wanting to do?
Since we got that, if that ARP money been spent in that, then due to all this down here at the hospital ICU, they agreed, if I'm not right, Patty, that they wanted to buy some ambulance to help offset everything and put the station back down there. We've already got the station back down there. And then I was going to order one that same year and pay it out of our budget. Okay, because I have to buy 2 ounces every year, miss 2 ounces, back and forth, because they don't last about 4 or 5 years at the most. But that's where the ambulances all came in at.
So that's where I was thinking about
But
3.
there's one that's ready.
Yeah, there's one that's ready.
One that's ready that the county was going to buy with ARP money.
Right.
That's got held up. The hospital was going to buy an ambulance. It was around $310,000 to help for the ICU and down there at the ER. I was purchasing one myself, this squad, to replace another one, and I will put it on a financial, 5 months, 5-year plan. But the county's only buying one ambulance, and it's the cheapest one. It's $241,000.
Did you say Ballot's position was contingent?
On what you all do.
Do you have any what's the reasoning for that? Do you know if you had any communication?
Letter, but I'm not sure.
There is a letter.
They did a grant. I think the confusion was Ballot thought that Terry already had a new ambulance in the pipe. We thought it was purchased until Terry went to pay for it and realized there was no money for it. But prior to that, Ballot said they would do a grant to match the ambulance that the county had already purchased. So that was before we found out there was no money to purchase it and all had fell through the cracks. And so they're basically matching what the county is purchasing. And then it came to find out that the county may not purchase it. They couldn't do the grant because there wouldn't be nothing to match if we don't purchase the one from the county. That's what they're wanting to do. But then Terry called me and said he needed to get the money for the ambulance. It was ready. And then that's when we went to the finance department and Carolyn said, there's no money for an ambulance. It got pulled off the list, and that's where all the confusion came in. But when we done the ARP list with health and welfare with Dr. Acuff, the money was to do the most good for the most people and the frontline workers and the healthcare system. And the ambulance was one of the first things on the list. And how in the world it got off the list and in between committees and me. And that was right when old commissioners were coming off, new were coming on. We had an election, committees were changing. It just fell through the cracks. That's just my honest thoughts on it.
That was the June 22 that I saw the ARP,
It's that,
and it was number 2.
it's that very extra.
Like I said, that was right before we came in, and
Just the extra.
so we took over September 1.
So is that grant still available?
It is. If the county goes through and does ARP and pays for the one that's waiting on us, Ballot's going to match it with a grant. That's what.
Yes, Doctor.
Just a clarification.
Yes, sir.
As Commissioner McInturf said, and Chair Holder just said, when it left health and welfare in the prioritization, the ambulance was number 2 on the list. Number 1 was fiber-based broadband. And somehow those priorities got rearranged in budget. You'll hear members currently on the budget committee, and I'd like either for Director Arnold or Deputy Director Harrison to address this, that in the new $777,000 contract with them,
there are monies in there for an ambulance. There are no monies in there for an ambulance.
Never was in there.
So that has been another uphill battle
Yeah.
in convincing them that all the monies are for operation. And I know that Deputy Garrison and I have talked about the number of new folks they're trying to bring on. But I would strongly encourage you to ask the budget committee, pass it out of health and welfare to approve the purchase of an ambulance for EMS. They're the only first responders that didn't get funding out of ARP. We gave to 911, a mobile radio station. We gave to every volunteer fire department monies out of ARP funding. They were the only ones that were left off the list, or how it was changed as it went through budget. And the mayor's right. There are a lot of changes that were going on. We had a chair that decided not to be chair anymore of budget, didn't show up at meetings, so they changed chairs, and it just got more confusing. But they dropped off the list, and that was not the intent. As the mayor said, is to serve the most people in this county. And we lose our healthcare safety net if we do not fund them and help them with this particular ambulance. I think those of you that went to the COPA meeting heard Commissioner Deal talk about idle times at hospitals when an ambulance would be out of Carter County, might be in Sullivan, might be in Washington, and sometimes those ambulances will stay 2 hours or more before they can release that patient and they'd be accepted by the hospital or the emergency room. So it really is important for our constituents to make sure we have those services available and for them to be able to take advantage of those services. Thank you, Chair.
So what we're tasked with tonight is the issue of the ambulance. We get a motion and the motion passed to send it to budget. Is that correct?
And I would send to them instructions. There are 3 ways they can pay for this.
I agree.
They can do it out of unassigned fund balance at one fell swoop at $221,000. You can use the part of the $1.5 million that will only be flowing through this county in this budget year that Carolyn Watson has talked about, or you can divide it up at $221,000 over 3 years. You can't say we're going to do it over 4 years, because then you obligate the next commission to a financial obligation that we cannot do. We can't obligate them financially or in other ways too, but since we're talking about finance tonight.
Okay. What I would like to make a motion that we do this. We've heard this at every meeting in the world. But regardless of what happened, new things have happened, which has made our ambulance, our EMS, even more important in our county than ever. So regardless of what the history is and what happened, he has one ready. And if we say, do you have a need for this ambulance? I'm sure your answer is going to be yes, that you have a need. Does our people need an ambulance? Yes. Are our ambulances more tied up all the time? Yes. So I think it's just simple equation here. We need an ambulance. And the biggest question is how to go about putting in the motion of which way to fund the ambulance. And I just want to make it clear, regardless of what Ballot Health does, I'm going to be honest, because you're a separate entity and so are they. So anything in agreement with grants, that's between you and Ballot Health. But what the county does, we're doing just based upon what we need to do as a county for the already ready to go ambulance. I want to make that clear too, that we're doing this based upon what we need to make right, what we need. But what he was saying about the 3 years part, how does that work with them though? I mean, what do you see works?
We would have to complete the loan that we've applied for it, and then.
You don't have a for sure approval on that?
No, not yet. I think they will, but not yet. We don't have approval.
Does that make life more complicated?
It's probably more complicated, yes, if there's an outstanding loan and.
So I'm gonna let Chair, you help and everybody talk about which way for funding and see what y'all think. But I mean, I just think it's ready and it's
I
done.
don't think that we can help budget.
No, we can't tell, but we're just gonna, do we need to list all three options?
I mean, you can list them, but they're gonna do whatever.
I know, but if he's saying the 3-year one might make it more complicated for them, I don't know if we want to include that 3-year option in our motion as an option or.
If they do their due diligence, they should know all the options.
Yeah, that's true.
My recommendation would be to either do the unassigned fund or the second.
So are you saying we don't list how?
I mean, I personally,
It's not, you could, hard they could take it out.
we can't tell budget.
Y'all can make a recommendation of what you think is.
Like we can recommend paying for it through unassigned or paying for it out of a certain way. And if we do, I was just saying, if it's gonna make life more difficult, we don't wanna list the 3-year version, or if it's gonna make life more,
Ms. Childers.
The only thing when you're looking at loans, normally a conventional loan is you're gonna have to pay interest on that loan for borrowing the money. So that could create unnecessary money being spent.
Well, let me put this in because I was at the budget, the last budget meeting and all that. They talked some different options like they're talking now. But they did say if I got the loan and they approve it, then they would pay for the loan and interest. And then I've also heard that we're just going to buy you one. So I don't know what they're thinking. But I've got to do something before I lose that truck. You know, we're in a building stage right now because of the contract. It mentions nothing about buying trucks or anything else. All that money is to make the place bigger, better response times with the more people. And then it got to where one of the commissioners said, well, you're buying an ambulance every year for the next 4 years. No, we're not. And I could not get it, emphasized enough that we're not doing it that way. You got the contract, read the contract, and it'll tell you exactly what we're going to do. So,
Well, I have to agree with you. I think it's time that we move forward because from what I can understand, the construction of one of these ambulances takes a long time, like you said. And, we can't go back and rehash the past. It's done. So I guess we're just tasked what we need to do tonight.
I'm gonna play devil's advocate for, that word, a moment. Dr. Acuff, what do you think the chances are getting through budget this time? Well, I think if y'all send a strong recommendation, I think it will get through. It won't be a slam dunk. It won't be 8-0. But we only need 5.
I personally think we should take it out of the 1-year revenue. We're getting 1.5 million in revenue. 200,000 is not gonna be a drop in the bucket. Unassigned fund balance will work, but raising taxes, we're gonna be on a limited budget. We can't drop below 6 million roughly, give or take. I don't wanna get nowhere close to that 6 million just in case something was to happen. So that is my personal opinion. Of course, we'll do whatever committee. I don't like the 3-year thing because, in my opinion, they've been screwed enough. So.
And the 1.5 that we have has been interest that has accrued on the debt.
Right.
Unassigned fund balance. So that is just the interest, where the interest rates towards the end of the year always rise. So we were able to bring in a little bit more of a chunk, but that's just a one time. So it's able to be used however you see fit because it's interest that was accrued.
And I think as a committee, we're tasked to do what's the best for the county residents and our constituents. And we do our due diligence and then we just place it over. We put the ball in their court, see where it goes.
I was just gonna say, and because ACUP is on budget, is there any recommendations you have of how we're wording this with them? I mean,
I don't think the recommendations is if the health and welfare of the county demanded. I don't want to lose EMS. I don't want to lose our safety net with them. So, I think that with a strong recommendation coming out of this committee saying, word it how you want, but to take care of our citizens with the redirection, if you will, by ballot health and how they direct our ambulances to other counties. We not only need new ones because they're getting ready to retire one, 400,000 on it.
Two going out.
Two.
Actually going out.
And whether ballot comes up with the grant or not, I just want to make sure that they get this truck. And in all fairness to them, they shouldn't have been dropped off the ARP funding list.
Now, from what I've heard in watching all the budget meetings and everything, and correct me if I'm wrong, but the best they could figure out, it was probably dropped from financial management. Would I be right in that?
Well, no, Julie Gwynn said, and I have yet to ferret the minutes out. Gwynn has looked for them for me. The minutes are really sketchy. Where it occurred was a motion made by either Aaron Fraser or senior moment. Austin. Yeah, Austin James, to drop it off the list. So they rearranged the priorities.
The list was recreated
Yeah,
completely.
Commissioner McIntyre's exactly right. They charged us with doing the priorities.
The full commission did.
Yeah, and we spent months on doing that with hearings and input from the community. So
I don't remember how many special workshops we had to put that in, categorize it, put it in order. And we were asked by the full commission to do that. It was voted upon to do that. When we knew the money was coming, we knew how much. And we sit in here for countless hours coming up with a list, and we had things that were very important that once it came about, they were gone. You can go back, the minutes may be there, they may not, but true, they were gone. I don't care if my own budget gets better or not, it's truth. It's disappeared. From top to bottom, they got rearranged.
One thing really bothers me about the whole thing, and I hope I'm not, as you said, making anybody on budget angry, but I find it hard to understand how somewhere along the way, it was dropped off. Terry was not notified it was dropped off. Then he places an order for an ambulance and he did something wrong. I have a problem with that because it looks like us as the county commission, we dropped the ball, not Terry. Somebody in the committees dropped the ball. Why are we holding Terry responsible for something we did as a group?
And also their credibility of ordered an ambulance and now this company's holding it. We don't want that to ever affect when they order again. Like, are they gonna order it back out? We don't want to.
Yeah, this company is in the business to make money. We can't expect them just to continue to wait for us and sit on that. I mean, they have bills to pay too.
Okay. So we might have to work on the wording, but so far I'd like to make a motion for the purchase of the new ambulance that is already completed, of the amount, in the amount of, and I've got 221, but what's the exact
We
amount?
handed it out for, but she's got one right here, an invoice.
I don't know if I have the newest. I don't have the newest one. That number may not be the exact number.
We just want it to be enough for sure if it's a little less, but.
Can we set an amount not to
Said
exceed?
it like not to exceed 222.
Yeah, that's what I was
Okay.
thinking, not to exceed.
I know it's like 221, 754 and some change or
Yeah,
something.
it's not, it's under 220. I just can't, I don't want to say the exact number.
Okay,
See, it was, first of all, it was $241,907. All right, during that process, just like they've been some problems here, they did not put that cost system in. That's why you're getting that $221,000 some odd dollars. But I'm paying that out of our own to get the cot to put in it. So,
So that's a savings.
We'll just say
I'd have to
not
get,
to exceed.
Not to exceed.
So make a motion to purchase the new ambulance, which is completed at the cost not to exceed $222,000. Do we put suggesting money come from, I guess this is going to budget, or
Recommending.
recommending that the money come from the $1.5 million that occurred from the interest,
It's non-reoccurring.
non-recurring. And then I thought we'd add, just to put in, due to the new increased need of emergency services for our county. I know, I'm just saying, we need to not just say it's because of what's happened, but we now have a new situation, so.
Do that need,
Due to the new immediate need for emergency services.
And I would second that motion.
Okay, do you want to reword it again and just start from the beginning so that way we know?
Help me here. Help me here.
Rewind.
Rewind, and y'all fill in the gaps when I stop.
Commissioner Oden,
Here we
just one
go.
second.
I think she's got it.
You got it? Why don't you read it?
You can read it.
Purchase new ambulance that has been ordered not to exceed $222,000. Recommending funds come from the non-recurring county funds due to the new immediate need in the county.
Non-recurring at
The immediate need for emergency services in our area.
1.5 million.
immediate need of emergency services in the county.
And how I look at it, we have to raise taxes, but let's make sure our people can get to the hospital when they need to. And that's what they're trying to do. Todd second.
Yes.
Ma'am.
Nick Holder,
Yes.
Avery Wynn,
Yes.
Angie Odom,
Yes.
Lisa Childress,
Yes.
Todd Smith,
Yes.
Daniel McInturf,
Yes.
Thomas Prophet.
Yes. Thank you all.
I'd like to say something.
Yes, sir.
You know, when we talk about funding rescue squad, it's not me. It's the image up there of the rescue squad. What you all do in here gives us ability to give better treatment to our citizens that we stand for. That's what I'm there, is to give them the best possible living that they can do. I mean, you know, as far as making sure that people are trained and everything else. If I don't have the county with us, backing us, I can't do nothing. Because I've been through it. I've seen what happened in the past where they do not support us and really just dragged us down. People left. They don't want to be a part of it. And as this new budget, new committees that formed the commission, they seem a little light there that you all were helping. But what you do is not doing it for us, it's doing it for the people in this community that we serve and protect. That's what we are here for, everybody, is serve and protect our people. I just want to say that it's not just us, you know, you go through life and you get enemies and stuff like that, and I have enemies, but I've never let it misjudge me from benefiting the people of this community. And we appreciate everyone. Whether you disagree financially, but don't use it as a grudge for something else. You know what I'm saying? And I do appreciate it. We have seen, we've talked about it, the difference in the commission, what it made to us, that at least they're trying. You know, we can't have everything in the world, but as long as we know you're backing us, we can do better. Just like anything in our jobs. You got somebody, yeah, keep going. Everything's gonna get better. I just want to appreciate y'all for what you do. I know you don't get a lot of it, and you always get the bad end of the stick, you know? I appreciate it.
Appreciate what you.
Whether it goes on farther, you know, all I do is try to tell you what might happen if it doesn't work out. And I've worked with fire services, I've seen it. One came in, he's going to go on the missions in the mountains, he's going to go to the rivers. That's trained, qualified people. They're not going to do that. You're going to have to form your own. And it takes years and years to be. So, just think about that. You know, we're on a mission right now up in the Laurel. Nobody knows because we don't get on the Facebook and everywhere else and say stuff because there is a rule called HIPAA. Things have been, I've seen a lot of breaks on Facebook about HIPAA. They should have turned them in, you know, and that's what we have to do. So you don't see that stuff. That we're out here on mission stuff. We're not going to bother. You see a car wreck and Facebook stuff. It's not coming from us. It's coming from other people. And, but I do appreciate every one of you for what you have done.
Thank you all.
And if I could add something, I appreciate it too. And just, there's light at the end of the tunnel with employees because we've hired, within the last year, I have 21 employees that have worked there a year or less. So 21 new people we've been able to hire. And, you know, hopefully I just need about 2 to 3 more and I'll have as many as we reasonably could hope to have right now. So, and it's due to this budget and everything that y'all have done for us. So I want to add my thanks to that.
Thank you all. I know we don't hear that enough. Y'all have anything else? That's your back to
It's been good the last 2 days to point back the wall.
Thank y'all for coming tonight. Anybody got anything else? EMS? All right, moving on. The Northeast Community Nurses Navigator Project Presentation. Gosh. This is Mrs. Alvis and Mrs. Lundy. They are nurses going to, and you can come out here at the podium.
I don't know that I'm tall enough to see over.
You're not, but I'm. You can come out here and stand beside of it, or you can.
I'm good.
Okay.
I'm loud. I'm Haley Alvis. This is Allison Lundy. We are both registered nurses with the University of Tennessee College of Nursing. We are working on the Community Registered Nurse Navigator Project, or CRNN. It might be easier for you to say. Our project is a grant that's awarded by the Tennessee Department of Health. And it's unique in that we are 2 of 16 nurses that are employed across the state to work in the communities, areas that we live in and that we're in. So Allison and I service the 8 Northeast counties. We both grew up in Carter County, live in Carter County, have family in the area. She's got kids in Carter County School. So while the health of the entire Northeast region is important, we have a special little place for Carter County. About our project, we are trying to discover barriers that people across Tennessee face in receiving routine immunizations. Things like MMR, polio, varicella, tetanus, pneumonia, shingles, just those routine things. Even before the COVID thing happened, children's immunization rates were dropping at very alarming rates all across the state. And of course, those have dropped even drastically more since the pandemic. And we've also found that many adults also don't know that there's immunizations that they should take as they age to help them be healthy and stay healthy. So those are things that we are hoping to cover as well. We know that barriers in one county may be different than barriers that folks in other counties are facing. And that's why this assessment part is so important. The ultimate goal of the project, of course, is to collaborate with community partners that are already well-known and well-trusted to help to prevent disease outbreaks across the state. So we do this by getting embedded into the county across all the different communities. So we want to talk to the people in Elizabethton, but we also want to reach those people in the more rural areas. So Kogi is gonna have different barriers than people in Hunter or the head of Stony Creek, Road Mountain, areas like that. So people with less access to transportation, resources, technology, things like that. We have multiple ways that we collect this information. So we interview stakeholders and community members. We do anonymous surveys with community members and stakeholders. We hold focus groups, try to assist and participate in community events. An example, last fall, the TLC Center had a flu clinic for the Spanish-speaking population. We are currently right now working with the Bridge to Shore Recovery, just with education on immunizations and everything surrounding immunizations and that type of thing. So we try really hard to maintain a no judgment zone. So we want everybody's opinion. So regardless of a person's stance on vaccines, we want to know where you are, why, how, all of those things, all very important. So we're doing these things with the health department, other locations that offer immunizations, things like mobile clinics, of convenience like the TLC Center. We can also help to provide immunization records that are required for school to help kind of lessen the load on the health department and the other healthcare facilities. So we are able to print those things off. Ultimately, we know that a person's basic needs of electricity, water, things like that have to be met for them to be able to focus on their health and their well-being. And if they're working and a clinic is only open when they have to work, they're not going to be able to take off to go for a checkup, especially an immunization. So those are some of the barriers that we're trying to find and overcome by maybe doing mobile clinics in certain places, especially in the rural places. What we want for you all to help us with, if you can, is help us to promote our company. We just want you to, let your family know, let your friends know, let your church members know. Partnership with individuals across the county and the region. If you can connect us with partners that you think would be willing to help us collect information through the assessment phase, that's wonderful. Any ideas or recommendations, interventions that you guys have to help us with, we know, especially by talking to a couple of you already, just being out in the community, you've seen different needs and you've seen what people are facing, and not just with immunizations, but with healthcare in general. And so we're really trying to help with that. In the orange folders, there are copies of our surveys. So there's parent surveys for kids under 18. There's also adult surveys, aged 18 and older. We're trying to collect as many of these as possible over the next 3 to 4 months in the county. There's also pamphlets in there with immunization schedules. Your pens also have a little pull-out immunization schedule on them. You might need a magnifying glass to see it, but it is on there. There's a flyer in there with a QR code, a link to our website. You can link directly to the survey to get those filled out. Allison has a business card in the folders, fiscal year budget. I do not have mine in there, but I have wrote it down in there. You can reach out to either one of us, both of us, any recommendations that you have. We know that the CRNM project right now is guaranteed through June of 2024. But we do have pretty high assurances from our leadership at UT and from the health department immunization that you probably are going to have at least 2 years. So if we can get out in the community now, figure out what those barriers are, and I think we can really help do some really great things in Carter County over the next couple of years while we have this grant. So anything that you can do, and I know Angie's been great, to work with. So any questions that anybody has about what we're doing?
Would you be willing to come back if your schedule permits and maybe talk to the full commission when we have a full commission meeting?
Absolutely.
That would help spread the information, and that would incorporate all of us in one setting. So that could be helpful for you.
Everybody's afraid you're going to give them a shot. You're going to say, who is not up on your invitation?
I give a great. Let's say that.
It's free. She wanted to know what the cost was.
Most of them are free. So it really depends on, we can do mobile clinics like through Health Heroes, and they focus solely for the most part on children's vaccines, and they usually will bill insurance if they have insurance, but if not, it's through the Vaccines for Children program, which would be free.
Thank you.
And the adults,
For the adults, usually we have to do it through the health department, so we can help with scheduling appointments, things like that. Health Heroes will do flu, COVID, and monkeypox vaccines. But that's all that they have funding for adults.
Any other questions? Thank you all so much.
Thank you.
Appreciate
Thank
it.
you all for letting us be here. We appreciate it.
Any comments?
Make a motion to adjourn.
Second by Mr. Wood. Ms. Childers said the motion, and Mr. Williams seconded to adjourn.
Okay, I'll go ahead. Let's go ahead and call the law enforcement committee, meeting, to order. Time looks like it's 6:55 PM. We'll go ahead and let the previous roll call stand. Has everybody had a chance to look over the agenda? Can I get a motion to approve the agenda? Approval of the May minutes, since we didn't have a meeting in June. Has everybody had a chance to look over those?
Make a motion to approve the minutes.
All in favor? Doesn't appear,
No, it's,
doesn't appear that we have any public comments at this time. As far as new business, I don't have any new business or old business. But one of the things, some of you all may know if you've read it in the newspaper, I wanted to recognize the Carter County Sheriff's Department, Sheriff Fraley and his staff for a job well done. On June 22nd of this year, the Tennessee Correction Institute came in, and from what I can understand, it was a surprise visit to walk through the jail and to talk with staff to see if they were in compliance on the minimum standards and the standards that had been noted in the past that there was a default on. And they came through, they spent the day, and I'm pleased to say that they found no deficiencies on this yearly inspection. So very proud of the sheriff and the hard work that his staff has done. I'm going to pass this around. This is the copy that I was given, and it goes into a little bit more detail about that date on June 22nd. Okay. Does any commissioners have any comments?
I think they've done a really good job, the staff, and Sheriff Fraley and his jail staff has done an amazing job. For where it was
Yes.
to where it is now, he has done great.
Yes, and that is very commendable. And he's done it, and he and his staff both have done it in such a short time period. They dug their feet in, knew what they needed to do, and got it done. So very, very proud of them. So that's probably something off their to-do list. Now, my understanding is TCI will come in, they come in once a year to make sure all the standards are being complied, and they never let you know when they're coming. They're usually random visits. So that's something to be proud of. Any other commissioner comments?
Make a motion to adjourn.
Second.
You're sure.
Be long. I'd like to call rules of bylaws order 6:50, 7 o'clock. We'll use the same Roll call. Got the agenda. I'd like to have a approval of the agenda.
I make a motion for approval of the agenda.
I'll second.
All in favor? Minutes for April. Approval of previous minutes. for April. If you read it.
I'll make a motion to approve minutes.
All in favor? No public comments. I don't have no old business. New business is discussion of email security. Open the floor for any discussion, any.
What about it?
You don't have to secure it.
That's your boat, isn't it?
Yeah.
I asked Thomas to put it on the agenda just so we could address some of the things that I discussed in our meeting last month. And see if there was something we needed to do more particularly, or is it something we just need to watch? We're going to pursue it. We won't do anything.
I'm not trying to be smart, but like, I mean, what are we talking about maybe trying to do?
Actually putting a policy in place. That's what I'm thinking.
Or
Security of the emails. I talked to Josh about this a while back, and I realized that those emails, they are public record. They can be pulled through a FOIA. My only concern is I think if they need to be pulled for a FOIA. I don't think anyone should get special treatment.
They're saying everybody goes through the same process.
Exactly. This makes us all responsible for the emails that we forward of our citizens.
Are you saying, maybe to help to clarify, I'll just use an example. Say I send an email directed to you, okay? And then you decide that maybe there's something that needs to be forwarded. Are you saying maybe refer back to me and say, hey, is it okay if I share this with someone else? I know the email was directed just from me to you. Is it okay? And here's who I would like to share it with. Is that what you're maybe referring to?
The team.
legality on
It's just an etiquette thing. I mean, you can put a policy in the procedures handbook, but there's just no penalty. I mean, there's nothing you can do about it. There's no punishment or anything like that.
As a recommendation.
Yeah, just like we do for health and welfare, if we agree to, we'd send a recommendation to the full committee. If we agree not to, it stops here. Right, am I correct?
Yes, you're also, yeah, if you propose adding something to the procedures handbook, we send it to full commission.
But say if there was a policy, I don't think there's, what I was saying, that you can make a recommendation towards this. I mean, I don't think, we can't do nothing about, we can't punish nobody, you know.
Right.
I don't. Not punish.
Would there be a possibility of maybe a disclaimer or something? Just say that, again, I'll refer back to my example. I send you an email and then maybe I put at the bottom a little disclaimer. If you decide to share this, do you mind to consult with me first or something like, I don't know what the legality would be on that. It
Wouldn't change. I mean,
How would you get that out to the voters? Because that's who I'm specifically addressing.
Oh, okay.
I personally, we kind of went down this road a little bit with our Facebook thing a couple years ago. I don't know if you remember that, Thomas. I think we created one, or we tried to create one based on a policy for Facebook. And, you know, if there's not anything that can be done, then the policy's not worth the paper it's written on, technically. So basically, you're just asking somebody not to do something. And if you've been in this long enough, you're going to find out that you can do that, which we've already done. Happened last month. I'm just not a huge fan of creating policies that carry no weight. I've been in jobs and places where there's been policies put into place, but there's no procedure to follow it if something does happen. And so what's the point of having a policy if there's nothing to happen from the policy? Other than people get upset because somebody broke a policy that carries no weight. That's my opinion. Take it, leave it. But there's nothing we can legally do if somebody shares an email that somebody else sends. And it's going to happen again. I'm just going to go ahead and tell you and everybody else, it's going to happen again. That's just the way politics work, apparently. So.
Well, the beauty of it is each of you all have in a public forum the right to say your opinion and speak your mind. And if something like that happens and you disagree with it morally or in terms of etiquette, you can address it. And you've got a public forum to do it, which is more than most people have with just Facebook or whatever. So that you do have a method to do that. It's just there's no formal punishment or penalty or repercussion whatsoever if it happens.
And if I understand it, I think what Todd's saying is you're speaking up for the citizen that was in your district about if a citizen sends an email.
Yes.
And if it's sent outside the circle of the government, like the commissioners or, the elected officials here at the courthouse or us, that you're trying to protect them from getting sent out is basically what happened. Is that what you're speaking about?
That's exactly what I'm speaking about.
Okay.
And I know, again, like I say, I know that FOIA, they can come and get everything they want. They can come and ask for every email from whoever for ever so long. I just don't think we, as elected officials, should have the authority to bypass the FOIA. Let everybody go through the same process. Don't show favoritism to anyone. I'm just saying, make it across the board where we know, and our citizens know, when they send me an email, unless they tell me to pass it on, and it may happen to me tomorrow, but up to this point, I've always asked before I forwarded everything, do you mind if I share this with? I'm just looking at protecting the privacy and the concerns of our citizens. We want them to contact us and share their needs with us, not dissuade them. And that's what worries me more than anything.
Well, I think what happened in that situation, that person connected 4, commissioners, the mayor and 4 commissioners. And then where you're in that district, they were like, who sent it out? It was like questionable who breached their confidentiality and sent it to an outside agency. So then it comes back to that citizen's mad at everybody, not knowing who did it. And that's why I think this is why I get it.
At the very least, there needs to be a disclaimer somewhere on our webpage or something notifying them that your email may be shared with an outside source. At least then they would be aware that that's a distinct possibility.
That's true.
I see what you're saying, but they're public records. And, even if this person, John Q, sends you an email, it can still be accessed. And I understand where you're coming from, but, you could tell them that, or they could meet with you in confidentiality and private and say, here's what I've got concerns about. But, like Commissioner McIntyre said, if it's a policy or procedure has no repercussions, I mean,
It became a public record when it was emailed, even if it wasn't to the county email, even if a citizen sends an email to your private email, if it is to you and your role as a county commissioner about public business, it's going to be public and it can be discovered even off of your private email or your private laptop at home. So that's where it becomes public, and that's just, I mean, that just has to be common sense for the public. I mean, the Public Records Act works both ways. The government's open, you share things with the government, it's open. So if they, if that person was truly interested in confidentiality, they can talk to you personally, they can send you a letter, give you a letter, whatever. But once that is sent via email, especially on the government server website, I mean, there's just no disclaimer can stop it. And it's just a moral, ethical thing at that point, or a etiquette kind of thing. But there's nothing you can do to stop it.
And you just said the two words, moral and ethical.
Unfortunately, if we could get everything into law and have repercussions on our own morals and ethics, the laws would look a lot different than what they do right now, in my opinion. We just can't do that. I mean, like I said, there's nothing wrong at all with having a policy. Y'all want to do that and have it in the book or whatever. But like I said, it sounds like maybe the most bang for your buck, or to get your point across, would be more addressing it in a public forum, pointing out that it happened, and you don't agree with the fact that it happened, because that would be more, I guess, that would affect the person who's breached this code more than some reprimand that you can do. Hey, you did this, and I think that was wrong. I want everybody to know, and you've got the right to do that. I just don't know what the policy would truly entail. That's just my opinion. I'll draft any policy y'all want. You all want.
Leave it alone. Because I'm seeing both sides of it as far as, I mean, there's nothing, it's pointless for a policy not to, I mean.
Can't enforce it, just
We'll just hope moving forward, it's brought to all of our attentions, and so maybe we'll all just be more cautious of it and moving forward. And then we can readdress it if it ever needs to.
I'm fine with going with Josh's recommendation.
Commissioner comments?
make a motion to adjourn.
You need a break?
I'd like to abstain from your agenda, though.
Good. Is everybody good? Keep rolling?
Yeah, let's keep
Keep
rolling.
rolling, get out of here.
Cuff knows you're gonna be here while he's leaving.
Call building and grounds meeting to order. It's 7:13. We'll let the roll call approved. I have an approval of the agenda.
I make a motion to approve.
Hang on a second, I apologize. We need to amend it. That's what's gonna take so long.
Oh,
I'm sorry.
All right, so let's make this, I guess it'll be good or new business.
New business,
New
A and
business,
B.
A and
New
B.
business A would be Herman Robinson campus. New business B will be the UT building. Discussion of the situation with the building. It's in bad shape.
Herman Robinson Dooley.
Yeah, Herman Robinson campus.
Well, that was A, Herman Robinson A. What was B?
UT Extension Building.
UT Extension, yeah.
All right, everybody got that on the current agenda, please?
Yes, sir.
Okay. So with that amendment, can I have an approval of the agenda?
I make a motion to approve the agenda.
Second.
Motion a second. All in favor?
Aye.
An approval of the May meeting minutes, please.
Make a motion to approve the meeting.
Okay.
Second.
All in favor, say aye.
Aye.
I don't see any public comments, so we'll move on to new business. A, Herman Robinson campus. Cool.
Okay, thank you all for letting me add that. I was just gonna bring this to the attention of the committee so we can start thinking about it. The Herman Robinson campus, it's right up here on Arnie Hill. It's where TCAT owns it. It's where the cosmetology and their machine shop is. And the sheriff's department also leases the back building where we do their training. They keep the ARAP vehicles. And then also our communication officer, Mark, will do all the installation of any radios. So that building's already there. Once the new facility is built and up and running in Stony Creek with the Carter County Higher Education Center, I asked if we could have that campus. They're going to give it to us. They're going to transfer it to the county if we want it. So wanted you all to be thinking about it. Of course, they're going to slowly start moving out as this campus up here begins to get built and all these programs. The cosmetology that's up there will go to the new Boones Creek campus, and then everything else will come up to the new facility once that comes online. And I'll just read you the letter they sent me. I talked to Chancellor probably back in April, and I had asked her if we could have it contingent upon the commission want to accept the property. So due to the existing and planned partnership with Carter County and considering the amount of time and money it would take to maintain the Arnie Street location, that campus will not be being used. The campus, we would like to transfer the campus property to Carter County as they will be moving their programs into the new Carter County Higher Education Facility. So that was just in the narrative of the disposal, how they dispose of property. There's 6 buildings, total of 31,017 square feet and 7.7 acres there that I've worked out the agreement and they're just basically going to give it to us. So that's a contingent upon us accepting it. And of course, we will have to take over. It'll come up under my umbrella with Ron as maintenance of a facility, but we're also losing this facility that Ron's pulling off on. So that was 100,000 square feet and 30 acres up there, and we've been maintaining that. Now it is going to need a new roof. They've currently been patching it. They decided not to put a new roof on it because once this facility was approved, they pulled back anything on that. And the sheriff department leases that back building for $1,300 a month. So that'll be a $15,600 annual savings pulling that back in with us. But of course it's under the maintenance realm and we are going to have upkeep on it, which may include, when we do accept the property, looking at my budget under building and grounds, because we will have to go in and do things. But it's a property that's going to be given to us. And it can be a location for a few different things. I haven't been in there in a long time, so I'm not real sure. But there's a lot of office. There's 6 buildings, office space. Let's see, I've got a list here. And I just got this actually this week, so that's why I didn't get a chance to add it to the agenda, Daniel. So there's 3 buildings that are classrooms, admin, 1 maintenance shop, a hazmat shop, and an auto storage. And it's a perfect place for my maintenance guys to go because they've got to move out of this facility up here. And if the committee so decides to accept it, they're going to go ahead and move some stuff out up there and allow Ron and Roy to begin moving their maintenance facility up to that property. So, we're still in the transition phase. We're getting ready. We hopefully get the documents next week, I hope, to close on this property and it'll be out of our hands and we can quit paying all the bills up there. And then when that happens, we can look at trying to take this property. But they're still going to keep it right now until they get everything out. But they're going to allow me to go ahead and let Ron and Roy move up there if it's something that you all think that you'd be interested in taking over.
You need us to do something this month.
How do you think we should?
They're not going to officially turn loose of it.
No, not till they move everybody out, but they're going to allow Ron and Roy to go on up there if
Well, they're not gonna do anything either until we get that paper, all that stuff finished for work. Correct?
Right, that's what I'm saying. I mean, they might go ahead and let you come up there, but I mean, we wouldn't officially accept it.
Yeah, and Ron and Roy, the maintenance shop can go on up there if we wanted to, and of course, they'll still pay for everything up there while they're there, the lights and all that, but they need them out up here because they're moving storage, and they're up there now moving stuff in where they've got their maintenance shop.
What all we moving up there?
Just tools and,
If it's not ours and we're kind of sharing, it's covered
It's
under.
still, I mean,
Yeah.
it's state owned.
State owned.
But
and they park their vehicles there so they could come from home and transfer out and that kind of thing. That's kind of what they do up there. It's a weird situation, but I mean, they're giving us a property that's 7.7 acres and
Yeah, sure. I just want to make sure that if we put tools and other.
yeah, I don't know that our insurance, I mean, if somebody broke in and stole all the county's tools, I mean, we'd have to basically sue the state. I mean, so their
or their
policy.
insurance would cover
Right,
it.
because our policy wouldn't cover it, probably.
But it would be at the state, and I talked to Dr. Hicks today, and he said he doesn't see a problem with going ahead and allowing them to move up there. But I want to make sure that there's a possibility that the committee would be interested in that property before we really, I mean, I'd honestly be crazy not to, but because the sheriff's department's already there in that back building, and that's where Mark will be working out of when the radio installations coming in for these vehicles. He'll be putting the cars in there.
To be maybe like double safe, we could do like $1 lease or something.
Yeah.
And just so we're covered under their umbrella, we're leasing the space or something
We
like
could draw
that.
something up like that, so we can at least get the maintenance guys up
That's
there.
probably what we should do, just
I
for
think
the
so.
time being
Yeah.
until just to cover
Uncover.
those tools. I mean, I don't know what all they're taking up there, but I'm sure they're not gonna be cheap.
No, we'll have everything that they used to work on.
If they're good with that, I mean, that wouldn't be.
Do you want to have them do a motion to have you draw up a little standard lease?
I'm happy to do it. I mean, if you, yeah, you can do that. And if you talk to the state folks and they're happy with me, I can do that. No problem.
Well, we'll clear it up on this end and then I'll handle it on
You
there.
go to full commission Monday night.
If you're planning on doing it that quick, I mean. But
I'll
yeah, I
make a
mean,
motion for that. That's a no-brainer. Do you think so? I make a motion to drop the lease for $1 for the maintenance.
The maintenance guys to move up to the.
Go ahead and move up 10 to 3 that work. Yeah. The Herman Robin, yeah.
Mayor, how soon can we take possession? I know that's gonna take some years, but I didn't know.
Well, that's, I mean, I hope that we're gonna be able to do a groundbreaking up there, which is phenomenal because we just done this facility up here, next month, or at least 2 months. We're gonna do a groundbreaking and then they will start tearing building 1 down, but they're keeping building 2 up until they transition from each building. So we're probably still about 1.5 years out. But they may get, I mean, something may come around in the time that they move everything out of there to different places, because I know the cosmetology is going to Boones Creek and that's moving out this fall. So that's open all that space up. So, and then they've got open, it's not all occupied. So it's just a weird transition, the way the time frame's happening, but.
So, sorry, Mayor.
Go ahead.
I got a motion. I got a second. Did you get who said? I didn't hear who said. I'm sorry.
Avery.
you can go to full commission and vote on this month. I mean, obviously I would have the lease ready. I mean, the agenda and everything's supposed to already been out, but we're holding it for this. So, I mean, it's got to go out first thing in the morning, then we'll be talking.
We don't have to do it this month. We can
That's
do
what
it,
I'm saying.
we can do it next month. They can handle it here and we can do it next month and help them over. How do you want to do
Well,
it? They go ahead and pass it here. and
Yeah, yeah,
handle it.
We'll
We'll do
go
it
ahead
next.
and roll with the motion tonight, and then I will
Maybe
make
you
sure that next month, it's on next month's full.
That gives Josh time enough to draw it up.
And we'll, at that point, full commission will be able to look at the lease
It's for
agreement.
money.
Okay, I've got a motion to have Attorney Harden draw up a $1 lease. So maintenance can move their equipment into the Herman Robinson campus.
Call roll, please.
Let's vote.
Roll, please.
Nick Holder,
Yes.
Avery Nguyen,
Yes.
Angie Odom,
Yes.
Lisa Childress,
Yes.
Todd Smith,
Yes.
Daniel McIntyre,
Yes.
Thomas Profit.
Yes.
All right, thank you. Let's move on to B, the extension bill.
And this is, Nick's probably gonna be able to chime in a little bit on this. The building across the street, that's the UT extension where the Christmas tree is, it's getting in pretty bad shape. And Ron, I just spoke to Ron today, and the foundation under it is completely gone. I mean, any time it can fall in. So, and then Nick's chair of the board, you may want to elaborate a little bit.
The building has been deteriorating at a rather rapid pace. When you go in the front doors, there used to be an office on your left. It's still there, but there's nobody in there because the upstairs, you can see the ceiling that swags, and they haven't had anything upstairs. Last time I was up there was 3 years ago, and you couldn't walk to the middle. You had to stay against the wall. We just fixed the water line in it, but that was an emergency situation. The building, as you all know, the deed, if we vacate it, there's no county entity, which it's not safe for anybody to be in there. It's be demolished. Personally, if we move out, it needs to be demolished, and I think it should go to the sheriff's department so they can put in a building or a garage and have storage or whatever, but that's just my personal.
And my thoughts are, since this came about the Herman Robinson, UT could move up.
Yes.
But in the interim, I think.
Until then, I mean, I don't know. I mean, I would like to get them out tomorrow morning, but you know, that's at least to put them somewhere. Because it's bad enough if it falls. If it falls, somebody gets killed. The world hurt.
Is that house considered, it's an historic, right?
It's historic district.
There is grants, but I know Tracy Buckles, which is on the agricultural committee with me, said she found a grant from the guy over at the Gray Fossil site, but it's only like $40,000. $40,000 ain't gonna cover the shingles.
Dr. Acuff's still here. We run into this historical stuff before, and
it is.
It's a mess. I mean, we looked at the property right here beside us. Don't get me wrong, beautiful property, but when you start looking at the historical side of it, your numbers go significantly higher.
But I think if we own it, which we do, and it's in the historical district, we're gonna have to.
Yeah, I think it's in, but yeah, you have to get approval. I mean, you know, they have to.
But we have to upkeep it. I don't think we can tear it down.
There was a restriction in that. It was a weird deal, but there was a restriction in it that said it had to be torn down, but it never, it's weird.
Oh, is it something we can look at then?
Yeah,
That's what you're talking about.
but doing improvements on it, what I'm saying, I mean, you gotta get, you know.
Oh, no, I mean,
have to place
if
the
it's
nails.
something we can,
You know, it costs.
well, upset anybody, I don't know, historical stuff it's very important to people, and I
Yeah,
don't.
they won't let you just do
Yeah.
anything. I mean, you gotta get the same windows and the same
Oh, yeah.
material.
It's what we went through for the courthouse, and the windows here. I had to go to the historical. Even when we tore these houses down over here, it was a whole process. But it was just something I want to make the committee aware of, and Nick's on
Was
board.
there anywhere to put them temporarily?
I don't know, Nick, is what Nick asked me. I don't know of anywhere to put them temporarily.
I mean, you don't want to put them out in the country. I mean, Siam would be the perfect place, but that's 7 miles.
It may be
What's
that,
in the old school office right now? Central office. They're in the process now?
Once they get finished moving out.
Yeah.
they're moving this week.
I don't know for a fact, but I
I mean,
would
at
say
least
that they'll probably come up for sale, but you know, we discussed that property at one time which I'm kind of getting ahead for archives.
Is it a flood zone?
That property, yeah.
I just meant temporarily to get them.
It
out.
may be that I can talk with Dr. Higgs. I don't know exactly what all is on that campus. There may be some small office space available. We can do them like we're doing Ron.
Northeast.
The Herman Robinson campus.
What about Northeast? What about up there right now? Remember where that, the group was that we had to run, we had to ask to leave?
That building's being tore down.
That's the one's going down? Which one's staying?
The one that Northeast State's in.
Are they using all?
Yes, TCAT's now gonna flow over to use some of that building too. So you'll have Northeast State and overflow from TCAT in that section.
TCAT has no space, they would let us maybe.
No, they're bringing storage over right now and filling up. That's why they want Ron and them out of there. So we've just run into a issue on everywhere.
But like you say, if they, Herman,
I'll check up here at Herman Robinson. I'm actually gonna go up there next Wednesday and go through the place.
Is education using all of Kingburg at this time? Would it be possible?
I don't know. I'm not sure that, I mean, it's kind of like moving a home. They're moving in and probably trying to figure out divvy, and I'd say we'll know more.
I think they are, because they're moving like the lift.
Yeah.
Academy up there too.
They're taking lifts.
Well, they get started or something else.
I forgot about the school at Siam.
I think they're gonna sell it.
I know it's a ways out, but could that be an option just for temporary?
I was thinking the office is so close to
How
where
many
they're at.
employees are actually in?
There's Kathleen, which is the ag agent. You've got Roger, which is the 4-H agent. You've got Rachel, which is kind of the director, and you've got Victoria, which is some more letters in there. I can't remember her title. And executive assistant. So I think there's 5 in there, but some come and go. So, but 5 pretty much all the time.
Any option, like work from home or anything like that? Do any of them do any?
They did for a little.
They did for about 2
We
weeks
had
when we had to fix the water
water leak
leak.
over there.
And UT was fine with that, but I think a
Yeah,
lot of people, like especially now where people want to can and garden, they have to come, they come to the office and, you know, they help them, they will go out. Now Kathleen can work from home because most times she does farm visits.
I'm just thinking from a safety
They still do their
standpoint.
parenting classes too.
Yeah, and that's,
Yeah, they do the parenting class.
That's why I was thinking the office right there was close to where they're already at, but I don't know.
I don't know what the school system's planning on doing with the central
I
office.
mean, even if it was just for,
Ask them. I don't know, if they plan on
we
selling.
all look at Josh. Josh, you should.
Well, the last I had, you know, had a conversation, it was over archives, because
Yeah.
we were really trying to find something, but then, you know, we found out the flood zone, and it's just, that would be
That'd be enough.
a debacle, so we kind of went a different route, and I don't know. I'm sure that I don't know that they have any use for it. They may, that I don't know of, but,
We just mean temporarily though, if they
Temporary.
could get up there.
and that might be a possibility. Mayor, if you wouldn't
I'll
mind,
check on it.
reach out. to Dr.
I was thinking there was some deed restriction or something with that it could only be used for.
Well, at one time, I think that the whole, there was deeds were, one group had one deed and another, yeah, so I don't know how that whole, so you'll work on that?
Well, I know this may be another idea, just thought of this. When we purchased the planning building, we it's a very large space. There's several offices in there. And we told Chris at the time that it would be purchased for them, but be aware there may be a time that we want to put an economic development or some other type of office in there. But they're occupying the whole place now, but that's just because we never have really found anything to put in there. There would be space possibly in there in planning for the girls.
Short term or long term?
It could be long term. The whole back piece is office space and conference room. I mean, it was Judge Rice's former office, and when we purchased it, it was contingent that planning would go there. And of course, they put offices in the offices that we thought we might use, but they are, and it's got a full basement in it. And the girls they needed storage at one point in time, and we were going to allow them to store in Chris's basement, but he's got it pretty full over there. But could be an option too.
That sounds
And it could definitely be for temporary and if not long term. Because the back of the office has got two big offices and a restroom. And that's what we were thinking would eventually use as we talked about economic development and someone to do that. And that's just never come to fruition.
They need out yesterday.
Yeah. I mean, I think
a
it's.
week ago.
Let's do this. I mean, if the committee's, if everybody's okay with it, let's let Mayor reach out to the school system. And then.
Let me reach out to the school system and talk with Chris down there at the.
Talk to Chris, and then I don't think it's something that we would have to vote on. I think if we make a decision, just let them know, hey, you can go here, go ahead and start and try to coordinate it with whoever we're with.
If we could find something, I'll get with you and you're the board and let the board know.
And in the meantime, we need to.
But then in the meantime, the questions will be with the house, what we want to do with the house.
Yeah, because we've got a meeting in about a month for the agricultural committee, so.
So let me ask this, does the committee want to try right now to get them out and then start to address the building? Or do we want to try to,
I think they need out.
I think they need to be out.
Yeah, right.
I mean,
Do we want to talk about the building tonight? Because I don't have a lot of information on the building to start to even figure out historically how we need to handle it. You know, is that something we need to push off to next month and let it just sit there and try to figure it out?
What I'll do is have Ron start researching what we need to do with the building as far as it's in the historic zone. We'll have to pull the deed and see what type of stuff would there be anything on the deed with?
Like I said, there was a deed restriction. I looked at it before that it was only be used for certain thing or it had to be demolished. I'd have to look at it again. It's been years.
I mean, if it had to be demolished, that's a nice piece of property right there that the sheriff's department could use.
But I mean, that was all pre-historic. If it's in the historic district.
Pre-historic.
Oh, that was just in the private deed transfer.
That makes
I mean, no, if you're, you'd have to get the permission just like this.
Oh,
if
yeah.
you were gonna tear
We'd
it
have to go through like we did for the plan of buildings.
Mike Nidifer told me that house was Confederate, the Carter Main was Union, or vice versa, and they were brothers, cousins. So they made the deed to where if something happened to the one where the agricultural people are in, and he died, that it's to be demolished because he didn't want his siblings to come up with it.
It was something.
And it is actually is what Mike said. He said if the county, or he said if UT vacates it and the county takes it over and they don't use it for a county entity of some sort, it's to be demolished. That's probably, like Josh was saying,
Yeah, but then the historic zoning, that's only been around about, 10 or 15 years.
Right, the
They
historic
started all
zoning
this
commission
into
would
the historic-
override that private
It wasn't fun.
restriction, because they now control anything that happens here, so you could tear it down regardless without their permission.
fall down before you can tear it down.
So,
Or if it, it might be bad.
I was about to say, I recommend that if he feels like they need out from what they've seen, I think they need out.
then that's what we're going to do.
And then
That
wait
we're
on
going to
the
try our
rest.
best to get them out
Yeah.
tomorrow if we can. But it may be a couple of days before we can
Yeah.
figure out which avenue we need to go or who can work with us.
Yeah.
And if that don't work, then we just need to start contacting and trying to figure out somewhere to get
Well,
them.
between Herman Robinson, the planning option, and then let me talk to Dr. Carpenter. Or maybe,
If it's just to get them for a few months where we can.
if I can just get them in somewhere temporary, then we can regroup.
Something to get them out of there.
And then that would give you time to do the research that needed to be done for it to come back in front of the committee.
That's what I'll do.
I can see the advantage of the planning commission. It's very close to where they're at now.
And the planning commission too, the way that building's designed, it's got the front entrance, which is everything, and then on the back side, it's got another entrance that they use, which can go, it could work there. I do think it could work. It's a large building in there. Once you get in there, it's cut up into a lot of different office space.
Is everybody good with that? So we'll keep this on the agenda. It'll move to old business, but we'll keep it here,
Yeah, keep it on there.
and, address it next month if everybody's okay with that. Everybody good? Any comments? All right, moving on, to old business. So we'll jump to county archives. I'm not sure if everybody's seen the email that come out, we'll be sending it out this week, about the lodge.
Masonic Lodge.
As an option for the archives, and the tour date set for, I think, was it July 24th?
4th at 5:30.
And that's on a Monday. Kind of like I told you all, whenever we were looking at the jail, I know you got lives, I know you got a lot going on, and I do too. So if you can, it'd be great. I think they've already been over there once.
Yes, we went over and looked at it about 3 weeks ago, I think, when it was.
If you get a chance, honestly, this is I think it could be an asset to the county. If everything falls into place, it's still
Close to 10,000 square foot. and almost 2 acres. And plus, it's right there at the health department. It's right there at the county, which we own the health department, we own the elections office, and then it's right there on the hill. So
It's an older building. I mean, it is gonna need some work, but for what the archives needs is, there's a list that's gotta be checked off. I mean, you gotta have so many, like, beat ceilings, and
he checks off every box for them.
Yeah.
She's been over there with me.
And the one thing that we have to make sure though with this property is that we make sure that it has a very thorough inspection, because I don't know how old the property is exactly, and I don't know how much it works.
The date's on the side of the
Yeah.
book. I can't remember what it said.
I can't
It's
even.
a fairly older.
It's old. I mean, not 18, but it's old.
68 or
Make
60.
sure that, and we can do that. And I think if we're interested, when it comes about,
That's why I think all the commissioners that can need a tour, look at it and see if that's something. The records committee's been over there, Lisa and Teresa, our genealogists and our historians, say it fits all their needs. It checks off all the boxes. So,
If you get a chance, I would definitely go and tour it. It's a lot of history in there too, so it's.
and they're interested, their membership has downsized tremendously. So that's
I actually talked to Trent today, and I told him, I was like, "Listen, you've got to let us know something, as far as and we talked a little bit about the membership and this.
their board will have to vote, and we don't know if they've actually brought that to the board yet, but he says that.
They did tell me today that, so whatever they decide, that they'll have to send out a letter to all their members, which could be active or inactive, and they would go to that. So it's like government, it's slow. Both processes are slow.
Their board has to approve the sale, but I guess they're trying to get a jump start and see if they can find any interest, and they'd rather have the county have it because they know what we're trying to do with it as far as the archives. And just in brief discussion with him, they're looking between 500,000 and 600,000. Of course, we'll have to have it appraised again. You all would have to vote for me to have it appraised. We'll get all that in, but that's where they're leaning at for the property.
They had it appraised.
Years ago, didn't they?
Yeah, it's weird.
But the archives fund has, I think, 750,000 in it right now, which you can use to purchase property and do anything.
And so on that monies, that's the only thing that it could be used for is within the archive. So.
and that's what the money was.
Yeah.
Yeah.
It was created for that purpose.
Anybody has backlash on that because they're like, well, you just raise taxes, but that money's
been in there for a while.
So it's the only thing.
It's not like we're just getting in the new budget year and talking about purchasing a piece of property. There's money that's
And
reserved.
that money's
to do
continuing
that.
to grow as long as it's.
And that's, well, like so the beer board, when you pay your beer license, so much goes to the archives. And you got that goes into it, which is strictly for archives. But if you do get a chance to go look at it, I think it'd be worth your time.
So again, that's July 24th, 5:30. And is everybody familiar with what we're talking about? Location.
Right there on the hill.
Yeah, right behind the old 911, the election office.
I would call a lady, I talked to Maddie, I haven't done it yet just because vacation busy, but there is a piece of property up near Snap-on. Front of Snap-on, used to be at the daycare. I think it's 5,000, I'm not sure, but I'm gonna call her just to have a backup plan, and I'll let everybody know. We can schedule
Is that just property with no building on it?
See, that's it's two different, so you've got the property on the back, then you've got the one with the building. They're selling it separate, what I understand. I'm gonna call and, I don't think it'll hurt to look at it,
No,
just for option B, C.
We've kicked this can, it's almost like there.
I gotta call her to schedule that with her schedule and stuff, but yeah, there's a piece of property in the building's got the property, then property right behind it too.
And I hate to say with this archives that there's a deadline, because, I mean, I guess technically they're not, but really,
Time's running out.
there is, because once they start this demolition process up
Got to
the
have somewhere
workforce,
to
we
put
have to
stuff.
have somewhere to put it, and we don't have space.
Well, and with that, if we don't have nothing and we have to rent, you're talking about
It's the same concept. They're pushing,
thousands of
they're
dollars.
pushing the maintenance guys out, and then I've still got that whole back unit that's full of all the records and storage. At least it's all in one location, but now we've got to get it
You
somewhere.
can't just go to a storage building and put it in. It's gotta be.
It's gotta
So
be.
You're looking at, if we have to rent something to,
You're probably gonna be going to Johnson City to put it somewhere. And I don't wanna do
then
that.
you're kind of at their mercy because they can charge what they want to.
So everybody kind of knows where we are. I've discussed stuff, Hammer Archives, I feel like every meeting, so we need to keep focusing on that. And it sounds like we got a possibility here, and that's closer than we've been since I've been chair of this.
The Masonic Lodge is just a good location too. I mean, it's town, people can get to
It's
it.
got a basement,
Yeah.
full
Is it
basement.
ADA compliant, do we know?
Yes.
The only other thing was the one I mentioned, which I don't know a lot about it, other than the Parks and Recs is moving out in Black Bottom. They did buy the building that's fitting. Yeah, and so that would be another option in case something, it's needed. Parks and Recs in Black Bottom, where the ball fields for the kids behind. So the city won't be using that. I did speak with, first Mike Maines, and then today I just called to ask Mike Simmerly where they stand on it. So it is confirmed that they've bought the building behind the hospital from Ballad. That's where they're going to. So they, at this, yeah, right. And so at this time, they didn't know of anything they were gonna do. It does have heating and air already, and it's already like for handicapped and all that. He did mention some repair about it on the roof, but like he was saying, if they were to sell, then you have to put it out there for bidders, if it's not the city. But he said they could maybe look at a long time lease if it's an interest, but I mentioned it to Patty already and I asked her to
I can
talk to Daniel. He said just to talk to Daniel about it. Not you, not that Daniel, that city Daniel. Or Daniel, you might know everything. Let's say.
I know.
But it's just something to think about if the others don't. Either way, it just happened to be mentioned. I thought it was worth bringing up. Okay. It'd be good if we owned one. You don't have to worry about a lease long term, but
$1 a year for the next 100 years.
there we go.
All right. Anybody have anything else with archives? Is everybody good? All right, Commissioner comments. Good deal.
Motion to adjourn.
Got a motion?
Second.
Second. All in favor?
Yeehaw.
That meeting machine.
I don't either.
There's really nothing else to add to the agenda. Let's go on.
Right, that way we don't have to sit on